So today I would like to speak to you about high lipidemia or hyperlipidemia, and by that I mean abnormally high levels of cholesterol and triglyceride in the blood. Cholesterol and triglycerides are manufactured by the liver, and they are useful components in the body. They are used for making hormones, vitamins, and cell membrane. So the diagram that is on the screen now depicts a molecule of fat or lipid molecule. So the yellow depicts the tail part that is hydrophobic, and the blue depicts the head. And this is carried around in the body by proteins, the combination of which is called lipoproteins. So this is what we'd like to study, because a buildup of lipids in the body can cause atherosclerosis, which can cause stroke and heart attacks. So that's why it is very important for us to take a look at it. Okay, stay tuned. Lipids such as cholesterol and triglycerides are very useful to the body. They are not bad unless they become cell membranes are composed of lipid. Cholesterol, for example, is used in the cell membrane to make the cells flexible. Other uses of lipids are, for example, manufacture of hormones such as testosterone and estrogen. Lipids are also used for manufacture of vitamins. Vitamin D3 is a cholesterol-based vitamin, and we have other number of other functions that the lipids play. So we're going to take a look now at what a lipid panel is and why the doctor orders a lipid panel. All right, so let's take a water break and then we'll discuss lipids some more. A common test a physician orders to aid in monitoring cardiovascular disease in a patient is a lipid panel. This panel includes testing for triglycerides and cholesterol. Cholesterol is broken down into three other components: LDL, low density lipoprotein, VLDL, which is very low density lipoprotein, and HDL, which is high density lipoprotein. Okay? LDL is sometimes called the bad cholesterol. It can collect in your blood vessels and form plaque. HDL is dubbed the good cholesterol, and it helps to decrease the buildup of LDL in the bloodstream. Very low density lipoprotein, which is VLDL, is usually in very small quantities. So most of the times it is seen right after someone eats a fatty diet. What is the purpose of doing a lipid panel? Well, healthcare providers use lipid panels to help assess someone's cardiovascular health by analyzing cholesterol in their bloodstream and to help to diagnose other health conditions. Reasons include a test to determine if your cholesterol level is normal or falls into borderline, intermediate, or high risk category. To monitor your cholesterol level if you have abnormal results on a previous test, or if you have other risk factors for heart disease. To monitor your body's response to treatment such as cholesterol medication or lifestyle changes, and to help diagnose other medical conditions such as liver disease. Okay, so those are the main purpose of the test. The following are risk factors for cardiovascular disease, and they include being age 45 if you're a man or you were a male at birth, being over 50 for females, 2 having a high cholesterol result on a previous test, 3 smoking, 4 obesity, 5 it's routinely done on a physical exam, 6 having high blood pressure or hypertension, also having diabetes or if you're in pre-diabetic phase, and lastly, having a first-degree relative such as a parent or sibling who develop heart disease at an early age, for example, under 55 in males and 65 in females. Children can also have high cholesterol, so your child may need a lipid panel blood test. Cholesterol levels in children are linked to 3 factors: hereditary, diet, and obesity. In most cases, kids with high cholesterol have a parent or who also have high cholesterol levels. Okay, cholesterol can also be associated with pancreatitis, chronic kidney disease, and hypothyroidism. A lipid panel, sometimes called a lipid profile, is performed by a clinical laboratory by a lab professional called a clinical technologist or a medical laboratory scientist. You need to fast for this test. In most cases, you'll need to fast 10 to 12 hours before your lipid panel blood test is performed. Fasting means you should not eat or drink anything except water for 10 to 12 hours prior to taking or prior to having your blood drawn. In some cases, lipid panels can be done without fasting, but the doctor would know of this prior to getting your results so he can correlate it properly. If your providers instructed you to fast and you accidentally break your fast by eating, please let the provider know because the test is not as useful without fasting. Once the clinical laboratory performs your lipid profile, results will be generated and sent to the doctor. Part of the results includes a calculation that is termed your risk factors. And this helps the doctor to see where you fall within the risk scale of having cardiovascular disease. So let's go over what the results should be. The optimal level of lipid panels should fall, for example, total cholesterol should be below 200 milligrams per deciliter. High density lipoprotein, HDL, should be above 60. Low density lipoprotein should be below 100 milligrams per deciliter. And triglycerides should be below 150. Okay. So if your results are higher or lower than the target range, they may be classified as borderline, intermediate, or high risk for cardiovascular problems. In general, higher than normal levels of total cholesterol, LDL, and triglycerides, and lower than normal levels of HDL can increase your risk of cardiovascular disease. Okay, so it's rare to have abnormally low levels of cholesterol. If you do, it's usually due to a health condition that's causing malnutrition. Okay, should I be concerned if I have abnormal lipid panel results? Okay. If your lipid panel results reveal that you have high levels of total cholesterol, LDL, and triglycerides, and low levels of HDL, it doesn't necessarily means that you have a medical condition or that treatment is required, but you should discuss this with your physician. A healthy cholesterol range also does not exempt you from having cardiovascular disease. Many factors are taken into consideration. There is a condition called familial cholesterolemia, in which it's a hereditary condition that patients have very high abnormal levels of cholesterol, even though they may exercise, watch what they eat, and so on. It's inherited. So this, in the next few slides, we will focus on some buildup of plaque in the arteries. This diagram, there are several blood vessels. The one to the extreme right shows a normal blood vessel with very little plaque, probably very little is in that one. The one to the right of that one shows about probably more than 50% blockage. So there's a lot of plaque in that one. The one in the section labeled B, those also shows buildup of plaque. So this is where it gets detrimental to one's health, when plaque starts to build up and if it erupts in the blood vessel and block arteries, causing a heart attack or a stroke. In this next diagram, plaque buildup is shown on both sides of the artery. The plaque has started to occlude or to close in the blood vessels. So the blood cells have to squeeze through the narrow passageway that is formed. So this patient needs to have some form of either medication or adjustment in lifestyle and diet to control the plaque that is built up. So then, why is it critical that we monitor our lipid levels? Well, there are critical organs that can be affected if we do not monitor our lipids and we have buildup of atherosclerosis. First of all, the brain. Plaque can cause chronic ischemia in the brain, and this can lead to mental deterioration and syncopes. It can form occlusions, which causes infraction, and it can rupture, causing hemorrhage. In the heart, atherosclerosis causes chronic ischemia, in which patients will experience angina. They are more technically called angina pectoris. Patients can be affected with myocardial fibrosis and myocardial infarction, which we know is a heart attack. Another organ that atherosclerosis can affect is the kidneys. Extrarenal stenosis can be developed, and this can be caused from hypertension. Also, intrarenal atherosclerosis can cause, again, hypertension and uremia, which is blood in the urine. Atherosclerosis can cause problems in the blood vessels such as the aorta and or peripheral visceral arteries. If usually stenosis, aneurysm, rupture, and or occlusions will take place in these arteries. If blood is cut off from the area, whether it's the extremities or the visceral organs, then gangrene can develop as the tissue dies. This is why it is very important that we monitor the lipid levels in the blood. In this diagram, we see a heart where the artery that supplies the heart with blood is blocked by plaque. The very dark area, almost to the apex of the heart, is showing where the muscle is beginning to die, and this can cause malfunctioning of the heart. So in this picture, you'll see another artery. This patient here is having a heart attack. Note that there is blockage, plaque blockage, also seen in the artery, and the heart is deprived of oxygen. You can see part of the muscles to the apex is also dying. Here is a cross section of a very badly damaged artery. The plaque has ruptured. There is a thrombus or clot, blood clot. There's fibrous cap shown in the diagram and the lipid core. And this is in a very bad condition. Hopefully, it is important to know the signs of a heart attack. A heart attack, sometimes called a myocardial infarction or a MI or coronary occlusion. It's accompanied with pain, excruciating pain. If there is sudden onset of pain, if there is a substernal pain, a crushing pain, individuals who have had heart attacks before says it feels like an elephant sitting on your chest. Severe tightness, it's almost as if someone took a belt and strap it around your chest and draws it real tight. Radiating pain to the back, the neck, jaw, arms, and shoulders. If there is dyspnea, and that is difficulty breathing, there's syncope or blackouts or fainting. This is usually caused from low blood pressure. Some people experience nausea, vomiting, extreme weakness, and increased heart rate. Anyone that has a combination of those signs should should seek help immediately. Medical help. Not home remedy, not housewife tale. They need to go to a hospital immediately. So the picture on the screen is a graphic of a head where the neck is cut into to reveal the carotid artery. This is usually the main artery that is blocked when someone has a stroke or a cerebrovascular accident. Okay, so this artery is either blocked or it has a stenosis, which is a restriction of blood flow, and that is what is going to cause a stroke. Coming up, I will list some signs of a stroke. These signs are to be taken very seriously as they can help to preserve one's life. Plaque formation can also cause a stroke, more technically called a cerebrovascular accident. Signs of a stroke are the face droops, slurred speech, confusion or lack of understanding, loss of balance, muscle weakness, impaired vision, severe headaches, loss of sensation or feelings, dizziness, loss of reflexes, numbness, hiccups, especially in females, and altered mental abilities. So, like the heart attack signs, if you see these signs in anyone, male or female, they need to go to a medical facility immediately. Time is of the essence. No playing around, no ifs, ands, or buts. Find a hospital if possible, or any other medical facility, a doctor's office, or a clinic. Okay. Things can be done if your cholesterol is high. You can try to change your diet, eat foods filled with fiber, a lot of vegetables, and less animal fat. Omega 3 um, fats are recommended, so you can get those in fish and seafoods and certain plants like olives and so on. Now, exercise is a good remedy, and if all else fails, then medication is given. There are certain statins that are given, and statins is only one type of medication that is given. There are other options that your physician will discuss with you. Okay, so this concludes the discussion of lipidemia, high lipidemia. Please like the video, subscribe to the channel, and I'll see you in the next episode. I think I'm going to discuss strokes. It's very important. Please subscribe to the channel. Please like the video, give it a thumb up. Please also share it with your family, friends, all your loved ones. This is some important information that could save someone's life. Don't keep it just a secret to yourself. Share it. Okay? Thank you.